was a student here at Western Kentucky University, special education major, and one night in my dorm room, cutting out construction paper spiders, I realized that I wasn't creative enough for this teaching thing, and I decided I wanted to work with those kids, but as a physical therapist. Western Kentucky University didn't have a physical therapy program, so they sent me down to the nursing program for advisement. When I got there, Virginia Lehman-Cooler, who was the director of the program at the time, told me that I really wanted to be a nurse, and she signed me up for all the nursing classes starting that January. So that's my story of how I became a nurse. Every time I tell it, my mother brings out pictures of me about 7 or 8 years old, dressed up as a nurse for Halloween, reminds me I had a Nurse Nancy doll, and she's convinced I always wanted to be a nurse. I have a feeling there's truth in both of those stories. The reason I switched to nursing was really the opportunity to make a difference, whether it's in the life of an individual patient, in the lives of my teams, and now here at HCA Healthcare, feeling like we are actually changing healthcare for the United States with the work that we're doing. My career goals when I first graduated were just to be a great nurse. The learning curve is steep, so working at HCA Healthcare has just been a huge opportunity. There is so much that HCA provides for us as caregivers, and the number one thing is the network. There are tons of opportunities available to nurses in HCA Healthcare. We generally talk about nursing as having 3 primary tracks: clinical, educational, and then leadership.
I always wanted a challenge. I wanted to take care of critical care patients, and I wanted to take care of the sickest critical care patients. HCA has poured into me in many different ways. Some of that has been through formal leadership. I was part of our director development program here in TriStar when I was a nursing director, and then took part in the executive development program before I became a CNO here at Greenview. Just being surrounded by amazing leaders every single day has been a key component of my leadership development. As I've progressed through my leadership, it's allowed me to have a broader impact on patients and to be able to advocate for nurses, but also to continue to face challenges every day.
We have the full gamut of nursing practice that you can move around, find your passion, find the place where you want to interact with patients. So HCA Healthcare is a great place for you to start your career or further your career.
They care about each individual nurse, and they want them to grow in their profession.
There are opportunities through our educational programs, which starts with our nurse residency program and moves into charge nurse education and then into training nursing leaders. There are opportunities through educational partnerships so that people can formally continue to pursue their education. And that may be through our partnership with Galen or just using tuition reimbursement to go to the school of their choice. There are opportunities through the bridge programs. We educate people to move from one area to another in the hospital. You may start as a med-surg nurse and then decide you want to move to the ER to critical care.
HCA Healthcare and TriStar Greenview just really pour into their nurses. They sent me to charge nurse courses as well as emerging leaders to grow as a leader. And then I've also been able to get my master's of nursing administration through their financial support.
Greenview has helped me to achieve my career goals by allowing me to be a part of projects, educating others, also leading and developing projects such as the Enhanced Surgical Recovery Program at Greenview. They recognize potential. They also ask what your career goals are to help you get to that point.
We are a family committed to taking care of our community. If you are committed to high quality care, come join our team here at Greenview because we certainly are committed to that same mission.
Greenview is a great place to learn and start a career. Lots of opportunities for growth. We get you to where you want to be.
So my advice to people just entering the nursing profession is you've made a wise choice. You have come at the right time. The nation, and certainly HCA Healthcare, has never appreciated and valued nurses more. We know what you do, we know the difference you make, and we know how important you are to HCA Healthcare and to the health and well-being of the people of this country.